So I had another patient come to me just yesterday with a carotid artery ultrasound. That really doesn't help the vast majority of us. All it is what we call a flow study. It's looking to see if the plaque inside your carotid artery impedes the flow. Well, you have to have about 50 to 60% of the lumen covered up in order to impede the flow. Why would we do that test? Well, number one, it's easy for the radiologist and the ultrasound tech, and number two, it means a big difference for people that are considering having surgery of the carotid artery. That's actually very few of us. So even though you can get it everywhere, you can get it because it's easy. For example, in Nashville, there were probably about 300 places where you could get a carotid artery ultrasound, but only 2 or 3 where you could get an actual CIMT. We often had people fly CIMT techs over to do a series of CIMTs. So why not just do the ultrasound? And why are we looking at, let's go back and just take a quick look at a couple of comments here. We're looking at impedance of flow for people that may need surgery, not for risk stratification. What do we mean by risk stratification? This comes out of the Cafés-de-Cave study. It's the ultimate study which demonstrated that, look, if you get CIMT, in other words, take that ultrasound of the carotid artery. It's the same ultrasound that all of them are doing. However, it requires that you get a very good technique on the common artery and look and get averages of the size of the plaque. Now, why is that helpful? Here's why it's helpful, and here's what we mean by risk stratification. This is the group on the left is normal, no risk. The group on the right is the group that you're looking for with a routine carotid ultrasound. Basically, you're saying these people have so much plaque, it has impeded their flow. This pink group, orangish pink, on the right, this third group with atherosclerosis, they have a plaque, 1.3 millimeters or more, or a high common intima media thickness, so a very large arterial age. These people, even though they have absolutely no impedance of their flow, are at 40% risk over the next 10 years of having an event. Well, if you look at it, the standard definition of high risk is 20%, half of that. So that's why getting a CIMT is so important. Now let's take a look at one of my CIMTs from a couple of years ago, and just focus a little bit on what these mean. So this is my common carotid artery here. This is the carotid bulb. That larger item there is that larger fork is the internal carotid, and the smaller one is the external carotid. If you're going to get discrete plaques, it's usually going to be in the bulb. Now, if you look down here, you see that blue arrow. I have a heterogeneous plaque, 1.6 millimeters there in the bulb. Now let's go back and look at arterial age. My arterial age here was 53, and at the time that I was 60 years old. How did they do that? They basically took a 1 centimeter section of my common carotid and took 600 slices out of that and measured that distance, the distance between that thin line, which is the intima line, and the thick white line, which is the media line. That dark space in between was the plaque, the LDL that they were measuring. Remember back from the video views and the clarification, the drawings, this shows an artery which is normal up here, and it gets more and more plaque as we go to the right. What we're looking to do is measure basically where you are in this progression. Because as you get too far, your immune system starts to attack this plaque. If it does, it forms hot inflamed plaque. That hot inflamed plaque, if it breaks out into the flow of the artery, causes a clot. Now here's where the issue about perspective matters. Let me see if I can move this slide over a little bit. There you go. Again, as usual, I have some image problems, but let's look at these couple of arteries. This is an artery cut in cross section. This is the media, this red area. This is the intima, this little thin area along here. That's hot plaque, by the way, and that's stable waxy plaque. So this is what you don't want to break through into the bloodstream. Now, back to the question about perspective and some of the difficulties in getting a CIMT. Look at this. In this one, you've got this much plaque on this side of the artery wall. On this one, on this side, just 180 degrees over, you have very little plaque. So, again, as we said, that's really, it's critical when you're looking to measure an age or estimate an age that you have the right number. And so as you start looking at this biological gross specimen from someone that died due to this plaque breaking out, you begin to realize that if the view comes through here on the ultrasound, they're going to get a very different perspective than if the ultrasound's coming through here. Let's go back and look at a different perspective on it. As you can see, perspective counts. Using that image, they obviously had these guys way up in front of the Eiffel Tower, and it looks like they're as big as it is. The perspective on these arteries counts as well, because again, if the ultrasound tech is coming through here, you're going to get a measurement of plaque that's about that thick. However, if he's coming through here, you're going to get a much thicker CIMT level. So again, this is just one of the reasons that you hear, oh, I know how to do CIMT, when maybe you don't. It takes a lot of effort and practice and training for a CIMT to learn how to do this correctly. And that's where Todd Eldridge comes in. He does a great job in terms of teaching how to develop reliable, repeatable standards within a difficult, subjective, sometimes environment. Now, again, you go back and you say, well, why not just go back to the old one? Because the old one doesn't tell us anything except whether or not we need surgery. What we want to know is this patient, or are you really at high risk? Are you at 10% risk or 40% risk? Big, big difference. Thank you very much for your interest.
Thanks, and if you hit that subscribe or like button, it makes a big difference. An even bigger difference happens when you share. You can share on Facebook, Instagram, LinkedIn, Twitter, Pinterest. When you do that, it makes a big difference in terms of the algorithm. It sends this to other people, realizing that humans think this is interesting information and helpful. Thank you again. So about 3 or 4 days ago, Michelle went ahead and put up the news of our upcoming event in Louisville, November 8th and 9th. Within a couple of hours, someone had already bought a slot. We had 2 other people who started asking about reserving space. What is the event and why did we set it up? Well, when we had the Healthy Life Summit, where we basically were a significant part of David Mainz's event, we got a lot of feedback. It was really good. People were very excited about it. But here's what they said. You need to do a PrevMed only event. Focus entirely on heart attack and stroke prevention. No business issues, no finance issues, no tax management issues. Those were all very good, very appropriate, and very helpful, but you need to start doing events that focus on cardiovascular inflammation, the major causes of cardiovascular inflammation like insulin resistance, lifestyle interventions, stroke prevention, things like that. So we're doing it. It will be in the Louisville, University of Louisville Event and Conference Center in Louisville, Kentucky. We will have CIMT and labs, 2 days of reviewing basically results on that, as well as the topics that I talked about. So it's like, instead of your typical evaluation with us where you get your labs and your CIMT and then spend half an hour to an hour with me based on whatever you've purchased in terms of time. This is going to be about 6 hours of my reviewing these results. That's the focus. It's not going to be a lot of new things and talk about supplements and stuff like that. It's going to be results of these kind of tests, so you can begin to understand what you're seeing. Now, how do the labs work? Well, first of all, we'll be getting inflammation panels, OGTTs, lipids, cholesterol panels, metabolic panels, other basic panels for, again, a basic evaluation. How about so is it an evaluation? Yeah. You get a CIMT. The CIMT tech is already scheduled. She'll be there both days. It's included in the event price no matter which of the two major options you get. That includes reading and interpretation of your CIMT by an experienced CIMT qualified radiologist. So again, no matter which of the two options you take, the CIMT is included. Now, we have a lab option available as well. It is additional cost. Lab orders will be sent, if you take that, the lab orders will be sent to you about 6 weeks prior to the event. You'll go to a local lab corps, get your labs drawn, and that we will send you a lab order with a requisition on it that covers your costs. We will have negotiated those prices up front, so you don't have to worry about that. What does that mean and why is that an issue? I'll get to that in just a minute. So you'll have your lab results available during the event. As we go through those labs and what the different results mean, you'll have them in front of you so you can begin to see what's going on with your body. Do I review my results with the doc? Yes. If you get the full evaluation with the labs, we include one-on-one time with me and one-on-one time with Janice as well. When? Well, it could be before, during, or after the event. The CIMT results will take about 2 to 7 days to become available. We'll cover interpretation of different types of results during the event. That's going to be one of the major discussion points. How can you interpret yours, even if you didn't purchase a full evaluation? So what are some of the concerns? Well, I think one of the first concerns is once you start talking about these kind of evaluations, they must cost too much. Well, here are the costs, and for a lot of people it is too much. 2 days with the CIMT is $1,450. You get the conference and CIMT, and again, the results from a qualified radiologist read on it. If you say, okay, you know what, I want to get labs as well, so we will pay for the labs out of that's $3,650. We'll pay for the labs out of the $3,650. We will also schedule one-on-one meetings with Janice on a health coaching perspective and with me. in addition, again, to the 2 full days of discussion of what CIMT and labs mean in your case. So yes, it's still a lot, but you know what? How does that compare? Well, let's go back and think about it. Again, I understand that's a heavy cost. It's still significantly less than what was associated with the 4,400 with the Healthy Life Summit. But again, you get a lot more of what I do and not so much of the broad dental perspectives, business perspectives. Again, as I've said many times, I'm continuing to try to make this more affordable. If you look at what we did in the past, it's better than 2 years ago. In the past, we were routinely charging $4,700. Labs were in addition, and additional labs can cost up to $3,000, $4,000 or $4,000. When Janice and I first did this as patients, we did end up paying $4,000 more for the labs themselves. We'll continue to improve. Our current base price for an evaluation, again, as you see on the website, is $990. That doesn't include labs, though. It includes what we call DIY or patient-driven labs. In that case, you're responsible for getting your labs. You're responsible for getting your CIMT. And why such a variation in lab costs when you go DIY? It has to do with this issue of DIY or patient-driven labs versus cash labs. The doctor didn't tell me the lab cost was $8,000. Now, I've not had any, I just got that picture out of the internet, and I haven't had anybody come back and say the labs were that much. But here's what happens. When labs negotiate with an insurance company up front, they are very, very reasonable because there's huge volume with the insurance company. Labs, once they realize that the insurance company is out of the way, and here's what typically will happen. The insurance company will agree to pay for the metabolic profile, maybe the fasting glucose, maybe the cholesterol panel. But then you get to the inflammation panel, which is the biggest item. If you get some of the other labs that your insurance company's not used to paying for, they'll say, nope, that's the patient pay. Now, most patients go into this process thinking, well, you know, I'll just get my insurance company to pay what they will, and I'll pay for the rest. Red flare should be going off in your head, because that's what happens with out-of-network labs. Then the lab says, I have you in terms of financial negotiations, and they will typically charge 10 times or more what they would charge the insurance company. So what are cash labs? Labs will negotiate not as well. I mean, they'll negotiate with the doctor before the testing as well. They're typically not as inexpensive as they are with the insurance company, but they're a heck of a lot less expensive than they are with the patient. So and that's what we're doing with this event. That's what we did with the Healthy Life Summit event. We negotiate the prices with testing prior to the testing with the labs. We'll then accept cash from you, and that's the cost that we discussed. So again, we are actually starting to do cash labs again. We've done it with less than half dozen patients, because it's an accounting nightmare. Anyhow, I see I'm going off on a tangent, but that tangent is required anytime you start thinking about the lab tests associated with this activity. Let's go back and talk for a minute about, well, it costs too much. For many, it still is too much. That's, again, why I've got over 500 YouTube videos out there for free. That's really the public health way. Educate, 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 make stuff available to the population. But that's also set up on an assumption of you can't afford to test, so you have to guess. Am I insulin resistant? Well, I don't know. Do I have inflammation? Well, I don't know. Once you start getting into a different perspective, test, don't guess, the testing is effective. There's nothing like knowing that you're insulin resistant to help you start thinking about exercise, thinking about cutting your carbs, thinking about managing your diet better. But again, it's expensive. Oh, a couple of other points about it costs too much. I realize it costs too much, but start thinking about it. How much was your TV, your last vacation, your car, your boat, your cabin, your jet ski, dental work? As you know, at one point in time, over half of my patients were dentists because they see this process with bleeding, bleeding and or inflamed gums. It was always kind of weird to me that they would discuss patients paying $5, $7, $15, and $64,000 for gum work, and then not which gave. I mean, it's very important, and I have no doubt in most cases it's worth it. I've paid significant amounts of money for some of my own dental work. But how does that compare to cardiovascular inflammation? So what's the upside? Your health, being healthy without disability and many years of your life. So I can't obviously tell you what the benefit and the cost is. I just wanted to make sure that we raised some questions so you thought about both sides of this issue. Will I continue to get better and get more resources out there, like, again, the free videos, the courses that are like $30 now? Yes, we're going to continue to make courses. We're going to continue to make more free videos. And again, so it just boils down to how much time do I have? How much does that extra time of waiting cost? How much money do I have access to? By the way, one of my patients, we have a video on him. His name is James West. James has got a significant experience in the finance industry. He and I have actually started talking about the potential for financing this work. We're not nearly ready for it, but hopefully over the next year or two we will be. We'll let you know as soon as we are. So again, thanks for your interest. Wanted to make you aware. Like I said, this appears to be a fairly popular option and event for people to get the entire exam, including extra hours focusing on this, and with a very deep 2-day boot camp, a one-on-one with me, a one-on-one with Janice, all the labs, and the CIMT. Thank you again for your interest.